Hi, this is Dr. Dunphy. I'm orthopedic surgeon at Hoag Orthopedic Institute and Newport Orthopedic Institute. I'm one of our sports medicine surgeons, and I specialize in shoulder, knee, elbow, hip disorders, mostly on athletes. I have a lot of questions from my patients and family members. How can I prevent a shoulder issue? So for throwing athletes, it's really important to have mobility and strength. Without those two things, a lot of shoulder problems can occur. So the main issues that I see revolve around the labrum. The labrum is a structure which stabilizes the shoulder. The shoulder has tons of mobility. It's the most mobile joint in the body and relies upon soft tissues to stabilize it. So in baseball, we have lots of force, lots of motion being put across that joint, which can put a lot of strain on these tissues. The labrum is probably the most concerning one with the most force on it. And we see a lot of repetitive trauma to the labrum. And there are certain activities and therapy exercises we can do to help prevent those. So the two injuries I worry most about in my throwing athletes are labral tears and rotator cuff tears. So when you throw a baseball, your arm is coming up in a cocking position. When you do that, you're putting a lot of pressure on the posterior aspect of the shoulder, and you're loading up and creating torque, and when you release, all that force is going to the attachment of the biceps. So the biceps is attached to a soft tissue called the labrum. So here's a model of the shoulder. Biceps tendon is gonna run inside the shoulder joint and attach to the top. So when you're throwing a baseball, it's cocking motion and then delivering creates a lot of force and torque on that attachment of the biceps. That can lead to something called a slap tear. The slap tear is very common in overhead athletes. It can lead to pain in the front of the shoulder when you're releasing, and actually can cause pain posteriorly in the back when you're cocking. So a lot of pitchers will notice they have like a dead arm or they lose velocity. That could be from a labral tear. Additionally, that same position when the arm is up and out can pinch the rotator cuff, which is up here, and that can lead to tears in the rotator cuff, which are usually small tears but can progress to big tears over time. So for my athletes who are throwing a bunch, I want to make sure they have good mechanics and good strength in all different planes to hopefully prevent the propagation of these micro tears and trauma into big problems.